Hi, Mr. Bishop. My name is Laurel.
Hi. How are you?
Good. How are you?
I'm good.
What can we do for you today?
Well, I came in today because I'm actually having a problem with my shoulder. I don't know. It's kind of right through here, and it really bothers me when when it gets any higher than this. So I don't know. Sends it over my head. I'm not really sure what to call it, but I came in today. It's just been bothering me. I can't ignore it anymore. I thought maybe it would heal on its own, but it's not.
Okay. Well, the script he wrote for us says something about a labrum tear.
Okay.
Do you remember any point in time in the past where it may have gotten hurt, or where you felt like a sharp pain right there or anything?
Well, I don't know. That's a good question. I'm trying to think. Sometimes at work, I have to put boxes up on a shelf, so I know like that's been bothering me. Not so much when I'm putting them up, but kind of on the way down. I play softball, one night a week, but it's 2 games, so I'm out there for at least 2 hours. And when I try and make throws from the outfield, I don't know, just me coming around. It seems like depending on the position, if I'm coming straight over the top, it's a little bit better. There's like less pain, but sometimes if I get anywhere out here when I try and throw it, I don't know, I just stand out there and hold it. It's not a good throw. I obviously lost my power, so I don't know.
Okay. Do you is there any history in your family or in your past medical history that like any other problems you may have had that may have caused this, like you were compensating for things?
I don't know. I mean, I've got a little one at home. She's a rascal, but nothing major. I mean, and that's one of the things too. It's like my daily life with her. Just trying to lift her.
So it hurts to
pick her
up and things?
Yeah, just like pulling her out of the crib and things. She doesn't weigh that much, 15 pounds or so.
Oh, she's little.
Yeah, she's newborn. She's like, I don't know, just under 3 months.
Oh, that's
She's
cute.
a cutie.
Good, good.
Yeah. So, but no, I can't think of anything else like major that I could have done. I don't know. Like I say, it's probably been wow. How many months now? It's probably been 3 months. Honestly, it happened a little bit before she was born, and like I say, I thought it was gonna go away. I just thought, like I must have strained it, pulled it. I don't know. Another thing too that I want to tell you is sometimes at night, actually, while I'm sleeping, if I'm like laying on my side, sometimes it will wake me up.
Oh.
Yeah, I know it sounds strange. I always sleep on a side, like I'm not comfortable on my back, and so like I don't know if I'm sleeping on the side wrong and it's like moving the shoulder in. I don't know. Honestly, I'm not sure. So that's why I'm here, hoping to get a good diagnosis about it.
Well,
some treatment.
Hopefully we can help with that.
All right, good.
Is there what kind of, are you taking any medications, or did the doctor give you anything for pain, or?
No. Actually, doc didn't give me anything for pain. He just said that I was allowed to take like ibuprofen, maybe ice it a little bit. So I iced it after my softball games. I guess I didn't mention that.
That's good.
Yeah, that is good. I don't every time, but probably 50% of the time. I'll come home and I'll ice it for a little bit. It just depends on if my wife's busy or not. I'll have her give me some ice. But I take some Advil because I think that's supposed to help. It's supposed to help with inflammation.
Yeah.
Is that right?
But it helps with inflammation, and Tylenol helps with pain. So you could actually probably take one of each if you would like to.
You want me to mix medicines?
That's not gonna hurt anything.
Okay. Wow. All right. Yeah, I'll have to. I didn't know that. I did not know that. So yeah. No, it's good because right now I'm only taking. I guess I'm only taking 2 Advil. I think the label said every 4 hours. So I usually just take it 2 times a day. It's like 4 Advil. So nothing too major. But is that all right? Is that an okay?
Yeah, that's. As long as the package says that, and if you're not experiencing any other problems and your doctor hasn't advised you against it, you should be fine with that.
Okay. Yeah, good. No. Yeah, that's what he said. He said just, take some Advil for the swelling. So it's inflammation. That's what I'm doing.
Okay. Have you had any other injuries in the past besides this shoulder?
It's a good question. I guess I have had some back problems before. Like I've been to a chiropractor. I go on and off. Maybe once a month or once every 2 months or 3 months for the past few years. And I've never had anything dramatic, I guess, happen with my back, but I definitely have had some lower back, I guess, problems where I've really had to take it easy, or I've had to quit what I was doing, or you know, go lay down, or maybe just rest it up for a day. Try not to do a whole lot, but as far as like my shoulder goes, no, I haven't experienced anything. Now I will say this, I broke my hand a few years back.
Okay.
Yeah, probably like 3 years back. I don't know if it's related or not, but I broke my. They told me it was my fifth metacarpal right in here. So yeah, I mean I had to. I mean they got it done. They fixed it without any surgery.
That's good.
Yeah, the hospital was able to push the bone back in place,
Okay. Did you have any physical therapy for that, or?
No, I didn't have any physical therapy for it because they didn't have to put in any pins or do
Okay.
anything like that. But I mean, it was casted
Okay.
for quite a long time, and I went back and saw, like the surgeon or whatever. But he just, I don't know. I got a good checkup. I have full function, good full range of motion.
Good. That's great.
Yeah, doc said I'd probably get arthritis in it someday, but for now, it's fine.
I mean, it is possible that because you've been, like, since your hand was hurt, you were doing other things, like trying to move it in different ways, that you did something to your shoulder that made it weaker, or just not using it as much because your hand was hurt, that it made your shoulder weaker, and then it was easier for you to damage it when you were actually doing your everyday life.
Yeah, that's true. That's actually a pretty good point because ever since like I broke my hand, I just stopped working out. So I was totally, just done and didn't do a whole lot for quite a while. And once I finally got the ability to do things back, I don't know. I guess what I'm saying is like I haven't been like working out, in the last couple of years. I mean, I've still been active, but not anything like I used to be. It's not like I used to, like what I used to do, go to the gym a couple days a week, but not anymore. So, like I say, I don't know if it's related or not, but like I say, it just started up like 3 months ago, and I'm just trying to look for some answers. Just like I say, I don't know, it's right through there. It's like
Right in this area, right here?
Yeah, it's like right in there. It's not.
Is it deeper, or is it more on the outer part of your shoulder?
I'd say deeper. I'd say deeper.
It's deeper?
Yeah.
Okay, well, let's go ahead and get you started with some mild exercises, and I'll see where you're at with everything, and we'll go from there.
Oh yeah, that'd be great. Thank you.
Okay.